But what I wanted to ask you, because this, I would appreciate your 2 cents on this, and I'm sure that the listeners would as well, is how to choose the right therapist for you.
Okay.
What would be your take on this? What tips do you have for someone who's trying to look out for a therapist? Because there's no one size fits all, and we might click with someone and we might not click with another.
Ara, what I'm going to share now is based on my experience
Yes.
as a client, not as a,
Okay.
not as a practitioner. So, the first time I saw a psychologist was when I was 8 years old. So I was very young. I had no control over seeing a psychologist. I was almost forced to go to a psychologist. And that was terrible. I did not want to engage. I did not want to comply. I did not want to go to the sessions. I was scared of my therapist. It was horrible. It was almost traumatic for me as an 8-year-old child. Then again, back in 2004, things were different. So the psychology profession was much less developed than it is today. So it was not what it is today. But over the years, I went to a number of different therapists, and I think that the second that you click with the psychologist, with your therapist, with your psychologist, you would know. However, one needs to be very careful not to make the mistake that I did for so many years, that you would stay with the therapist just because you're comfortable, just because the psychologist is just because psychologist is telling you what you want to hear. That is quite dangerous, because you might leave the session feeling very, very good about yourself, but and then a couple of sessions down the line, you would realize that no growth happened. There was no improvement, because you didn't possibly delve into the core issues as much as you needed. So for me, I feel that there needs to be a balance of feeling a sense of connection with the therapist. However, having a challenging therapist, someone who challenges you, someone who asks you the uncomfortable questions, someone who tells you, who pushes you to delve into things that you would possibly have been avoiding for years on end. And it's not easy to find someone that gives you both, I would say. So I think that what has helped me come to a point with my therapist where I can be completely vulnerable was the trust and the non-judgmental attitude that the therapist ultimately gave me. So I personally can't be with someone who is judgmental or who is going to tell me things in a possibly too bluntly.
I'm going to be the devil's advocate here.
Uh-huh.
Shouldn't be therapists not judgmental?
All of them should be, but not all of them are.
Yes.
So
that's why we receive training, right?
Yes. When I say non-judgmental, because I think that to some extent non-judgmental, all of us are to some extent non-judgmental, because that's what we've been learning since we were in our first day for doing the B Psy course. But then the way that the person communicates differs. So a person can be non-judgmental but can still be quite blunt, which is not necessarily a bad thing. But some people deal with it well, some people deal with it not so well. So I would say that you need to find what works for yourself. As much as I appreciate someone who is blunt, I know that I, as a person, I'm not saying this as a psychology practitioner or as someone who practices, but as a client. If someone is very, very blunt with me, I tend to get a bit defensive, right? So if someone if I would have developed and consolidated the relationship with the person, and then I can take a level of bluntness. So for me, it's a process.
A level of bluntness.
Does it make sense?
No, it does. So,
but for me, there has to be a level, but I am still not in a position where I can take a lot of bluntness, but I appreciate a person who is blunt. But in my experience, the person has to be someone I trust.
Okay.
So if I am not sure whether I can trust that person, whether I can trust that person's intentions, I will not take that bluntness well necessarily. But that's me. So there might be people out there who would want someone to be blunt with them and who would want someone to take a certain positioning with them, and that's okay. So I think as a person, you need to. You can't expect to go to a therapist and find the perfect match instantly.
Definitely.
It's something that you would. I think I've been to like 4 or 5 or 6 therapists myself.
Okay.
Until I found the person that I can totally be myself with nowadays. And it took me a long while. So from the very first session till the point where I started opening up to a very deep extent, over a year had passed. So we don't go to therapy to discuss the weather or to discuss politics or to discuss current affairs. We go to therapy to open up wounds that we would have spent years trying to conceal and trying to heal by ourselves. So it's not easy. In my forensic experience, I've learned that, and I tie this a lot with my childhood experience of when I had to go to a therapist by force.
Mm-hmm.
In the forensic field, most of the time, our clients don't have a choice. They have to come see us because either it is court mandated or it is on some form of order, treatment order. So that is something that I always struggle with. It's one of my dilemmas to a certain extent, because I understand that us professionals can say this person needs therapy and issue a treatment order or issue the conditions for the person to attend therapy. But I understand that unless the person really wants the therapy, we can have all the sessions in the world. We can keep on meeting weekly. Unless the person wants it, it becomes a box exercise.
Yes.
So this is something that on an ethical level, I struggle with a little bit. So to what extent is therapy effective with people who are mandated to attend therapy?
Mm-hmm.
That's something that in forensic psychology is something very common. In other streams, it's something that it rarely comes up because, especially when it's when you work privately, clients most of the time come willingly, not always. Sometimes you might have people who come because their partners would have forced them to, or because their parents or someone important to them. But in the forensic field, it's something that we often encounter, and something that I often try to ponder upon a little bit, and I haven't yet come to a conclusion.
Yeah.